Going. We're live.
All right, perfect.
Yeah, you don't have any more in your car.
How are you?
Hi, you're looking great.
I would say 77. I remember.
How you doing? Wow. I made it. Yeah, I have one upstairs and downstairs. I'm going to bring this to the house. I can see things about them. Hey, how are you? Thank you. These, but I didn't.
Yeah. There's only a photo release. If they can, if they like handing it to them, I guess. Photo after. They're being
Almost ready to get started. If you want to go ahead and just scroll it in, and we're gonna let Diane do her presentation, and then we do have the air purifiers, and I have them in the back of the room to give out. The American Lung Association has asked if anybody is willing to share their photo, if you could take pictures, giving them out so they can, you know, whatever. If you're not interested in being photographed, it's not necessary. Still can have one. For the filters, when you get it home and take it apart, the filter itself is wrapped in plastic, so you have to take the cover off and take the plastic off.
Oh my God, that worked well.
Yeah, and then it makes it a fire hazard. So open it up and take the plastic off the filter before you put it in. That's kind of it for the housekeeping for the filters part. So we'll let her do her presentation after. We're going to wait another few minutes because it's not even 1 o'clock yet. And then we'll do the photos after. If anybody wants their photo, take it and put on the website, then we'll do that. Thanks for coming. There's cookies up here. Okay. If anybody wants to write this. And then I'm going to probably bring you chairs.
We usually have a couple people online who, I see one is online now, so we have some people who don't like the group setting. So you're good, so you can see her and the slides? Yeah. And then I think the slides are probably the most important part to see.
Do you want me just to put it up there then?
Yeah, I think that's good. Because I think if you're.
Yeah, you need to click the next one.
The only problem, The only problem with that one is it's kind of, you can't read it. Let me see, Audrey. Yeah. From walking through there?
Yeah.
Oh, yeah, we're gonna have to move it over here,
Why don't you
though.
put it right here, and then we will avoid it altogether.
Oh, for you
Oh,
guys?
so put it here.
Or does she have to get it there?
We'll just put it on the other side first.
How about right there?
Yeah, like this. And then you can plug yours in right there. Is she gonna stand right here?
Well, then when we do that, let's move the chair so she can sit on that. Move that chair over to there.
No, this chair has Velcro on it. It's the soft part, at least.
What?
This chair has Velcro on the back part, but it's the fuzzy side. Is that okay?
Yeah. Audrey, does this mean that this is me, or are you technically, or is that someone else?
I'm not sure. That could be our online participant.
Okay.
I think it is, because I'm not logged in. It shouldn't be yours.
Okay. It's not me, I'm not logged in. You are logged in. Your drops was out of your pocket.
Okay.
Welcome in. Grab a seat, Diane. Okay.
Diane, where do you want me to be?
What's that?
Where do you want me to be? Sometimes I take a
I'll
pop.
stand back there. I was just staying seated.
Oh, you're,
until-
okay, perfect.
Until we started. Perfect. I just didn't know. Okay.
Okay, yeah, I just didn't want to be in your way, and sometimes people put questions on here.
Okay.
So sometimes I do this so I can see if anybody's asked anything.
Okay. Perfect. Wow, you got a huge crowd.
I know, it's kind of nice. It's never been this big before.
Free, you have to have something free every week.
It's the air filters, is what I'm sure is what it is.
No.
I hope she has.
I don't think Tamara brought enough cookies.
That's okay.
She said,
Yeah.
maybe one, maybe.
Well, we normally only have about 14. Or no, 9. 9 is the most. So we usually have less than that. We usually have about anywhere, I would say our average is probably 4 or 5. But so I think it's the air filters by people. Yeah, we'll have to bring more air filters. So.
Yes, I did.
Thank you. Must be in the front row. You ever quit to get your in there? You just never work out a piece of gear. My mom just.
Okay, you're gonna get started.
Most of them retired.
So this is Diane. She is with the Alpha-1 Foundation's Idaho Community Support Group, and she is going to talk to us about Alpha-1 Antitrypsin Deficiency, and what that is, and what she does, and what it means to all of you people. So, Diane, take it away.
Thank you, Audrey. So, What's causing my COPD? Could it be hereditary? Oh, you can't hear me? Do you have a microphone? She's saying she can't hear me.
We don't, I don't think we do. Do you want to stand like a little bit closer? And
I have to-
slides for you? You just tell me when to click them?
Okay.
I don't think we have the microphone in this room.
If I stand more over here, can you hear me now? Now, okay.
And this chair's for you.
Do you want to move even closer?
good to take. Everybody's so far away. I don't know why you guys said it like this.
Oh, there we go.
That's better. That's really good.
Okay. We're rearranging the room.
You know what? We're just gonna make it work. That's fine. You want to
There's a lot of people. They accept me.
I know.
Yeah, we don't have as many here.
Yeah.
Anybody that's really hard of hearing want to sit closer?
There's some chairs right here.
Because we need to kind of switch them around on this side too, yeah.
So I'm hard of hearing too, so I get it.
But you're soft-spoken too.
I am. That's only because I have 30% of my lungs.
Yeah.
I got off work as quick as I could. I was working. So it's like, so.
Put everybody to work.
I'll try to speak up. So,
Do the best you can.
so what's causing my COPD?
Now. She's just kidding.
I like your sense of humor. Could it be hereditary emphysema, Alpha-1 Antitrypsin Deficiency? So, are you thirsting for knowledge? Let me share with you what Alpha-1 is. Interesting. What is Alpha-1 Antitrypsin Deficiency? It's a genetic disorder passed down by your parents, and it presents with lung and liver disease in adults or liver disease in children. Everyone in this room has Alpha-1 protein that's manufactured in your liver, gets excreted out of your liver, gets transported through your circulatory system, and it plays a really important job because it actually penetrates all your tissues as it travels. But its main job is to work with an enzyme in your lungs called the neutrophil elastase. He's kind of like the Pac-Man guy. So when inflammation occurs in your lungs, fire smoke outside or cigarette smoke, that enzyme will pop up and he starts eating and he cleans up the inflammation in your circulatory system. It's the Alpha-1 that pops up and tells him he's done a good job, and they work together. So what happens if you're deficient? The Alpha-1 protein that's made in the liver actually doesn't fold correctly. So it actually gets trapped in your liver. So what happens in the lungs when inflammation occurs? Neutrophil elastase pops up, starts eating, chomps up. There's no gatekeeper there to tell him when to stop. So he continues to eat, and then we end up with hereditary emphysema. Eats up the alveoli in our lungs. That makes sense? Any questions?
Does that have anything to do with having phlegm or mucus or anything in there that build up?
I think just having COPD contributes to that. So I'd like to share my personal Alpha-1 story. So basically, as a child, I was healthy. It started to begin in my 30s. I was a mom raising 4 children. And some of the common things that were different about me is when I got sick, either with a virus, the flu, a cold, I was always much sicker than my peers. So instead of a standard 4 to 7 days, I'd be sick for 2 weeks. The other things I noticed during that time was when I tried to get back in shape and run the track with my girlfriends, I couldn't run very well. I thought, oh, well, maybe it's a God-given thing. Some people can run, some of us can't. Same thing happened when I went cross-country skiing. I would be with friends that were actually smokers, because it was very popular in those days. And I'd be at the back of the track. So during that time, going to the doctor's office, I got diagnosed with exercise-induced asthma, viral asthma, and asthma, and I was given inhalers. I would do my inhalers because that's what they told me to do, but it didn't reverse my symptoms. So I actually analyzed it by saying, well, that medicine must work for some people and it doesn't work for others. And that's what I thought to myself. It can be very overwhelming before you get a diagnosis of Alpha-1. It took me 10 years and 7 doctors to get a diagnosis. It was actually not until I had abdominal issues, which ended up being female problems. My female doctor sent me to a gastroenterologist. And first thing he said to me, he said, well, let's do a CT scan. When he did that CT scan of my stomach, he actually got part of my lungs. And when I went in to see him, he said, I'm going to send you to a pulmonary disease doctor. What? He said, I can fix your female problems, but you do need to go to a pulmonologist. So I was compliant. Off I went to the pulmonologist. First question he asked me, had I ever smoked? I had never smoked. My parents never smoked. He said, well, I think I might know what your problem is. I'm going to need to do a blood test. I'll call you back when the results come in. So I waited a week or so, got the phone call. Back I go. There I am sitting on the little white bed. He comes in and he says, congratulations. You have Alpha-1 Antitrypsin Deficiency. He goes, the bad news is it's fatal. Good news is there's therapy. Bad news is it's a little expensive. Then he looked at me and he said, how old are you? I said, 46. And he said, oh, usually you guys are dead by 40. That was my welcome to the Alpha-1 world. I didn't even get a pamphlet. So I was diagnosed in 1996 at the age of 46. I married my lovely husband in the back of the room there in 1997. And then him and I together for 27 years have done the journey with Alpha-1. So how do we genetically inherit Alpha-1? So the Alpha-1 protein sits on the chromosome 14, and it's a pair of genes. They identify the genes with letters. The M is your normal, healthy gene. Then they have an S as in Sam gene, and that is moderately deficient. And then we have the Z gene that is totally deficient. So each parent carries a pair of genes. My dad was an MZ, my mom was an MZ. When those couple have a baby, they only disperse one of those 2 genes. So my parents could have had 25% chance of having an MM, totally healthy child. They had 50% chance of having an MZ child, and then they had 25% chance of having a Z child. So basically, my parents hit the jackpot twice. My brother, in the beginning, went and got tested after I found out that I had Alpha-1. Excuse me. When his test came back, his physician told him he was low, but he didn't have it. Yeah, I like that look on your face, because I was so new. I was just brandly diagnosed, and I wasn't up to snuff on everything. So we just accepted that. 9 years ago, my brother had a lung transplant. He lost 3 years of getting augmentation therapy. So that makes sense? You understand the genetics, how you would get your genes, your genotype. So when you find one alpha, it really is important to test the rest of the family. So I had 4 children. So I have a Z and a Z. What did I give my kids? A Z. But they're all MZs. Yay! This son right here married this lady right here, and guess what? She's an MZ. We wouldn't have known if we hadn't tested. So they are the same scenario as my parents. They had 2 sons. Both their sons were MZ, so they were lucky they didn't get the ZZ combination. My grandson got married 3 years ago. This month, he just had their first baby. And they tested his wife right after they got married, they tested. Guess what? She's an MS. So she has the moderately deficient. So they can have an MM child, an MS child, or an MZ child. So knowing is pretty powerful, because you can change your lifestyle of living. Somebody was a smoker, or say they worked in a casino. We don't have any of those around here, but just to give you an idea, it's important to know. They have not tested the baby yet. So what do you do if you find out that you have Alpha-1? What's the treatment? So we take an IV medication, which is the Alpha-1 protein. It's extracted from plasma that they collect from human beings at plasma collection centers. And they lyophilize it, and then it's shipped to us, and we can reconstitute it, and we take an IV infusion once a week for the rest of our life. So I've been doing it for 27 years, every week. So in our Alpha-1 group, our community, I should say, we have financial support and emotional support. So this is a whole busload of alphas at one of the big national conferences. The other thing that we do is we also, just like the American Lung Association does, is we advocate for finding a cure and educating the community. What is Alpha-1? So this is a group of our local Idaho alphas that we did a walk down in Idaho Falls a couple of years ago, and we had a really good turnout. I know this year, Audrey and Kathleen are going to create a team for the Alpha-1 to do a walk for the cure. And that's done through the foundation. So you click on to alpha1.org. You can click on join a team, and then you pay $25 and you'll get one of these nice t-shirts. And you can get together and you can walk as a group, or you can walk at your own pace. You can sign up as an individual and do a walk, whether you do it by yourself or with your family. You don't have to, if it's overwhelming to create a team, you don't have to, or you can join a team. So it is empowering for all of us to work together. I know the Alpha-1 community also works hand in hand with the American Lung Association at the Cape Cod, and they do a big bicycle ride there to earn money for both the disease groups. And it is empowering for us to work together. There's power by numbers, right? And with the COPD community and the Alpha-1 community, all of our symptoms are so simple similar, and we all have the same needs. We need oxygen, we need our medications, and so that's why it's nice that we can all work together as one team. So now I have a test. Were you all listening? Can you see that board or this board? I used 10 years ago, I had a job that I traveled 17 states. And I actually went into physicians' offices and reminded them to test for Alpha-1. What I commonly heard is, oh yeah, I can spot an alpha. I know an alpha when they walk into my office. So I'm going to ask all of you, and I'll back away, and looking at these 4 pictures, how many alphas do you guys see? I'll give you a second to look. Okay, how many think that there's just one picture up here that has alphas? Nobody? Okay. How about 2? I'm in there. Well, that's good. I was a little bit younger. There's 2 pictures. Okay, you think there's 2? Okay, that's fine. How about 3 pictures? How about 4 pictures? Well, you're a pretty smart group. Yes, every one of these individuals that you see in this picture have Alpha-1 Antitrypsin Deficiency. So you can't really tell what we look like. Sometimes if we're wearing oxygen, it's more of a telltale, but you can't. Anyway, I want to thank you for listening to the presentation. It was a pleasure to be here today. My husband and I run a support group for Alpha-1, and I want to invite Tamara to come up and tell you about testing for Alpha-1.
Hi everyone, my name is Tamara Mitchell, and I have a need with a goal. How many people think I'm a healthy individual? You guys have me nervous. I am totally healthy. My FEV1, I had it done last year, is 104%. I do have slightly abnormal DLCO. So let me ask you another question. How many of you think that I carry a deficient Alpha-1 gene? Okay. 3 out of the 4 people that raise their hand know me. So that's not fair. I am an individual. So when you look at me, you would never think I'm healthy, have a little bit of abnormal DLCO. I've had the exercise-induced asthma diagnosis. I've had inhalers throughout my life. So what I've been around the Alpha-1 community as well. Hint, if you look at me and you look at our former speaker, there might be a little bit resemblance, right? That is my mom. So I've been actively involved in the Alpha-1 community as well since 1996. I decided to join what we call the industry, the Alpha-1 industry, 13 years ago. So I joined a specialty pharmacy and I helped develop an Alpha-1 advocacy program. Alpha's taking care of alphas to make sure they got the medication. Then almost 5 years ago, one of the drug manufacturers, Grifols, asked me to come on their side to help promote Alpha-1 within our physicians. So I am local. I'm the one going to St. Luke's, St. Al's, Boise Valley, as an allergy. I'm going to the allergy group. We do hit some of our primary care, but not a ton. We're working to kind of increase that to help them understand that when patients who have difficulty breathing come into their office and they have a diagnosis of COPD, 1 in 7, I'm going to say that again, 1 in 7 have an Alpha-1 deficient allele. Now, let me bring a little comfort. That does not mean you need to go on therapy, right? Not everybody, somebody like me, is healthy, has never smoked. I don't work in an industry where I'm breathing bad pollens or bad, dust. But like my mom, I passed on that gene. So 1 out of 3 of my children have the gene. My level is high, his level is low. So the severity of your levels kind of vary. So I'm in our doctor's office on a daily basis, educating them and helping them understand why when a patient with COPD, an appropriate COPD diagnosis, why would a patient with an appropriate asthma diagnosis walk into their office? Why it's important to also rule out, and that's what we're doing, we're ruling out Alpha-1. So I do the treatment. That's not why I'm here today, because that is a smaller population. What our company did, and again, I'm going to be disclosed, we are a for-profit company. Okay, Ripples exist to make money. But what they realized is that in order to find alpha patients, they were going to have to create a screening program for free. So we've come a long ways in healthcare. It used to be anytime we had a diagnosis, it affected our insurance, it affected, life insurance. What Ripples did is we created a free screening program for patients that it's between you and your physician. It goes to a lab that we have contracted with. The results go back to your doctor. You do not pay a copay. Your doctor does not pay for the lab test kit, and the results are not submitted to your insurance. So somebody like me, I'm still young. I want life insurance without having to pay a little bit higher premium. I don't want that on my record, right? So I was able to screen without it going through my insurance. So we did, and I brought one of them. It's simple. These are what I give to your doctor. I did bring some. I have more downstairs. You're welcome to take them, but it has to be doctor signed. So what this is it's a buccal swab. It's basically collecting your cells on the right side of your cheek, collecting your cells on the left side of the cheek, putting it in a solution, shaking it up. Ripples pays for the postage. It goes to the East Coast. It runs through the lab. Those results get faxed directly back to your physician, and then there's a conversation between you and your physician. I am out of it. I don't know who you are. I don't know what the doctor has told you. The only time I will be in the loop is if the doctor feels like he needs to treat a patient. Still don't know who you are. So that's completely free. The other one we have, I did not bring because sometimes it's a little bit more intimidating, is the finger prick. You know the ones that hurt more than just blood draw and your finger throbs for like 10 minutes afterwards? We have those as well, and that gives the doctor the full picture of you. This will say, what are your letters? Are you a CZ, an MZ, an MM? If you're an MM, eat a bag of M&Ms to help, right? Or there's 14 common deficient alleles, well 13 because we have the M. Most common deficient alleles that together would require treatment. So we've got the finger sticks. I have those too if you want them. They're in my car. That gives both the serum level and your genotype. These are super easy. There's no pain. That give you your just your genotype. The other thing that we created, which we realized was pertinent, is at-home screening. This takes away your physician, okay? We do it with 23andMe. The study, the COPD Foundation did a study after our 23andMe results and discovered that over 50% of double deficient alpha patients did not tell their doctor. So that's not a good thing. So I'm just going to say, if you want to do an at-home test kit, it takes your doctor out of the picture, but it will give you, it is a cheek swab. You'll order one. They send it to your home, you register that test kit, because there's going to be a number. You conduct it at home, you mail it back, and then they will mail you your test results. If you are an MM, great news, right? If you are a ZZ, you need to have a conversation with your physician. St. Al's uses our test kits. St. Luke's uses the internal test kit, which both of those are great. But you want to remember, if you have a diagnosis of COPD, if you have a diagnosis, an appropriate diagnosis of asthma, you should be having a conversation with your physician to test you. Because the feedback I get is, oh yeah, so my sister-in-law, the one my brother married, her mom smoked for 40 years. She had an appropriate COPD diagnosis. Physicians will tell me, no, they have COPD because they smoke, or they have COPD because they were a farmer. But that's not necessarily the truth. They could have COPD, but maybe their COPD developed at 30 versus 55, right? The underlying cause could be Alpha-1. I just had recently pulmonary send a 10-year-old kid to allergy and asthma. The patient was diagnosed with asthma, but continually reordering their bronchodilator and was not stabilized. One of the allergy offices was like, have we screened a kid for Alpha-1? Sure enough, the kid was a ZZ at 10 years old. Here's the good news, the earlier we diagnose, the more education and empowerment the patient can have, which the goal is to delay treatment, right? Let's stay healthy and keep our lungs healthy long enough that we don't have to go on therapy as soon, and we can stay off oxygen a little bit longer. So that's what I do. I educate. So I did bring some pamphlets. If you're interested in the at-home, this kind of tells you how to order one. If you would like to take a cheek swab, you are welcome. I underestimated how many people were coming. I have more in my car. When I'm done talking, I'll walk down and just grab them. You're welcome to take this. Please remember, again, it requires a doctor's signature. I brought some pamphlets from the Alpha-1 Foundation. Again, it has nothing to do with my company or our treatment. It just basically says, what is Alpha-1? Am I a carrier? It's all in the family. And then I did bring a little brochure of the 14 common alleles, common mission to that. We're still underdiagnosed. We're still, about 95% is estimated to not have a diagnosis of Alpha-1 that has the deficient allele. So these are the 14 common alleles that come back on our test. So that's kind of what I have, and brought a few cookies. But I do, regardless if you test and you're an MZ or you're an MS and you'll never go on therapy, joining our support group is so essential. I mean, the amount of people that get brought in for education, even just things like, well, they brought in Brian Visick, who's an allergist locally, to talk about the various bronchodilators and the education, or copay cards on EpiPens, or copay cards on some of the bronchodilators. A lot of education, so even if you're not on therapy and you find out you're an alpha, getting connected is huge. So that's all I have.
I'd like to reiterate the fact that if you get tested, so
That'd be good.
So the Alpha-1 Foundation, the COPD Foundation, there's one association, all of these foundations, their recommendation is that every person with COPD or asthma or bronchitis, any of these things, gets screened and tested at least once in their lifetime to see if they have these alleles or not. If you don't have them, you don't have to do anything further. If you have some abnormality, if you have an MZ or something like that, then everybody downstream in your family should also be tested because of that possibility that they could inherit the gene. So that's why it's just really important you can talk to your doctors about getting tested. If your doctor is here at St. Luke's, just let them know that you went to Better Breathers and you learned about Alpha-1 and you want to know if you've ever been tested, because chances are you might have been tested, chances are you might not have, and it's worth it to get it done. At least once. Yeah. If anybody has any questions after the fact, I believe everybody here has my email because I sent out the reminder. If you want to reply back, if you have any questions you want to ask individually, feel free to email me and I can get you the answer. If you have any questions specifically for Diane or for Tamara, you can email me too and I will pass them forward.
And if you guys are just here for pulmonary rehab and you would like to join the Better Breathers, let Audrey know, give her your email and she'll email you that information too.
If you didn't get the email from me, you can let me know and I'll put you on the list for a reminder. Right, but that's it. So. Okay, that's good. So now the really fun, other really fun part, it's giving away free stuff. So, if anybody wants to